Hi, welcome to another episode of Swim for Land. Now, this week I'm absolutely delighted that I've managed to get Dr. Alastair Cook, who is the Principal Medical Officer in the Scottish Government. Now, the reason why I'm delighted is I was able to ask questions and get answers instead of just me making stuff up every week. So I was actually able to find out information from him about what we can do, where we go, and what we can expect to be provided for sufferers of and people who live with mental health issues when we come out and during, because who knows when we're coming out of this pandemic. So without further ado, I'm delighted to present from the Scottish Government, Dr. Alastair Cook. Dr. Alastair Cook, how are you?
I'm very well indeed, thanks, Tom. It's lovely to meet you.
It's nice to meet you. Thank you so much for coming on. I'll explain to you a little bit about what it is I'm doing. I feel as if I'm putting on a posh voice because you're the doctor. We've been chatting for a few months online about mental health issues, broadly speaking, because I suffer from depression and anxiety, and I've found that with all the stuff that I've tried and all the stuff that I've done, speaking about it has actually been the best tool for me to tackle it. And coming out, when we eventually do come out of what is going on at the moment, I just want information. I just want to know, and people that watch and listen to the podcast will be looking for where to go if they're struggling, because I think being locked up for nearly a year is going to cause some trouble with people. I know I got ill again last summer with depression and anxiety, and it was mainly due to isolation, and I struggled to find help back then. So what has happened recently? Because I know that you've introduced loads of new stuff. The Scottish Government has. What resources can people find now? Where do we go for help?
Yeah, so there is a broadening, Tom. There's a lot more stuff available now than there used to be. I suppose the traditional route would always be, if you had a mental health problem, then you would go and speak to your GP, and if the GP couldn't help you or sort things out, then they would refer you on to mental health services, and we know about the potential for long waits and things like that. So
yeah,
what we're trying to do is to introduce a whole range of other things that people can use, and ways that people can access services.
Well, I'm a big advocate of talking to your GP, because I've got a great relationship with the health centre that I've been with for about 25 years, and they kind of know my history and they get what's going on, and they've always been really proactive about helping me. But I did struggle last year to find online sources for help. To try and get some sort of counselling or other. I got given the address by a medical professional, gave me an address online, and I ended up in NHS England, and they said I wasn't qualified for it and it just, I got frustrated about it. And I had a wee look at the new website that you were directing people to on the briefing last week, and I found that really simple and really well laid out, and exactly what I could have been doing with last year. So what is that website again?
So that's clearyourhead.scot.
Clearyourhead.scot. So we'll put that up behind me there.
Brilliant.
Because what I liked about that was it was very practical about what you can do in your immediate surroundings. Because back in my parents' generation, mental illness, you just didn't discuss it. And if anybody mentioned it, then it was thought of as you'd get locked up. Whereas now, I think that there's going to be people that have never spoken about this, and going to their GP and speaking about it is going to be frightening.
Yes. And I think that's something that we really want to try and promote. So Clear Your Head, I think, is a useful start in this. But coming out of the pandemic, we're really going to have to think about mental health much more, because we know that there's going to be a big impact of it. And I think that point that you make about in previous generations, people didn't really talk about it and didn't really think about it is important. We need to get to a place, I think, where everybody is aware of their mental health. So it's not that it's not a binary thing that you're either mentally ill or you're mentally well.
Mm-hmm.
Every day, people's mental health varies. Everybody's mental health varies.
Yeah.
You know, and so you don't. You need to be thinking all the time. Actually, you know, are there things I could do today that would help me just feel a bit better, and make my mental health better? And a lot of the information that's on clearyourhead.scot is relevant to everybody. It's not just if you're struggling with your mental health. Actually, you can benefit from it. And if everybody was more aware, then I think more people would catch when things were starting to go wrong a wee bit earlier, and be able to do things to try and help themselves. So I think
it should become as commonplace as going to the dentist.
Absolutely.
But because the stigma thing, I think, is the thing that we're going to come across as a bit of a problem. I mean, I'm quite open talking about this stuff now. I went through a phase of pretending I was fine, but that wasn't working. And I think people of my generation are kind of a bit better about opening up about it. But people, 20 years older than me, and maybe the older generation that have still got that, no, everything's fine. I don't want to admit that I'm feeling, because it's not just young people and middle-aged people that suffer from depression. There must be a lot of isolation going on with elderly people at the moment, and also with teenagers that are maybe trapped in a house where it isn't ideal.
So rates of depression in the past, you would have looked at the way things were mapped across the age groups, and seen depression rates actually got higher as you got older. I think at the moment it's not quite as straightforward as that, but we're identifying a lot more depression in young people. I don't think that's really about a change in the way that depression is. I think it's about recognition. So I think younger people are much more conscious and aware of the sort of their mental health, of the symptoms that indicate that they're struggling, and are hopefully more prepared to talk about it.
Yeah, because they won't have had this this kind of, I can't describe it. It was like, don't tell anybody.
This is it.
It was almost shameful to be suffering from a mental illness.
I think that's right, and I think that's a good thing. But what we need to really emphasize is that being more aware and having some issues and having some difficulties doesn't necessarily equate to you needing to have specialist mental health care. That actually there's loads of stuff that you can do before you get to that stage. So clear your head stuff is that sort of idea. But then there's things that can happen if you go and see your GP. There's things that can happen in primary care settings. So more and more we are working with GPs to look at putting in mental health workers into settings. So I used an example in my local area. The local newsletter came round, and the GP practice always has a page just saying, what's going on in the practice, what's changing, what's going on. And they had a great wee sort of half page on the mental health worker, who's actually a liaison nurse who works in the practice a couple of days a week. And just saying, if you're struggling with your mental health, call us up and speak to the mental health nurse in the practice. You don't need to see the GP. Actually, just go straight to
a mental health nurse. Because my only experience of actually being on a waiting list and getting a psychiatry appointment, it was a few years ago now. It must be about 5 years ago, but I was on a 6-month waiting list. And then when it eventually arrived, it was like, it just wasn't, it was just vague. And I got a pamphlet and a CD and I had to draw a picture. It was very kind of vague, basic CBT that was on offer, and it just didn't help me at all. And I worry that things haven't changed, but I'm assuming that things have changed in 5 years, because it's now ramping up, isn't it?
Things do change, and Okay, they can be a bit patchy. Okay, there's no point pretending everything's wonderful, because it's not. There's tons of gaps, and I mean, I talk about mental health nurses in primary care. Only a small number of practices have got those at the moment.
Yeah.
But we're looking to expand that. But the other point is that lots of different approaches are needed to be available, because what works for one person won't work for someone else at that particular time.
Yeah.
So what you need is a variety of things.
Well, that's what I felt when I eventually got the help. It felt as if it was an all-encompassing, tailored for anybody going in with, it felt as if it was just like I was going in with the same headache that anybody else would have, where I was going in with particular things that were happening with me, and it just didn't seem to be dealing with that. But I mean, a lot of that probably came from I did have a lot of that West of Scotland man. Actually, I'm fine. There'd be some days I would go into the appointments and go, nothing wrong with me. Because I didn't want to open up and start talking about all that kind of stuff, because I would, I knew I'd end up being upset. But what else I want to ask about is, I mean, people, I don't know about statistics and stuff, but people are talking about the suicide rate at the moment going up. Now, I don't know if that's true, but I'm very aware that I hear about it a lot now. There seems to be somebody every couple of weeks that I know of.
Yeah.
What is the first port of call for somebody who is having suicidal thoughts? Is there an emergency thing they can do?
So the best thing to do if you're really urgently needing to talk to somebody and get help is NHS 24.
Okay.
NHS 24 now have a mental health hub, and the mental health hub operates 24/7. So NHS 24 used to be just an out of hours service, but it now operates full time, 365 days a year. And behind that, when you phone 111, you'll get the option to speak to someone in the mental health sector. And if you go through to that bit, then you'll get to speak to someone called a psychological wellbeing practitioner.
Right.
And they're trained and supported by trained mental health nurses behind them as well. But the PWPs, as we call them, can talk through your problem, discuss things with you, and if necessary, if you need specialist mental health support, they'll send you up to your local mental health assessment service. So they can direct you straight to whether that's a CPN, a community nurse, or whether it's the psychiatrist at your local hospital. So they have that ability to do that. But actually, most of the time, in talking to someone and giving them advice and support, actually they can resolve the situation.
So it's almost like a mental health first aider.
Yeah, absolutely. The other thing they have the option to do is to pass you on to a thing called distress brief intervention. And I don't know if many people will have heard of this, but around about 12,000 people in Scotland have had this over the last year. And what distress brief intervention is if they think if NHS 24 or any other first responder, so the police have access to this, accident emergency departments, EDs have access to this, and the ambulance service have access to it. But if they think that you would benefit from talking to someone over a couple of weeks through a few sessions, they can refer you on for this distress brief intervention, and it's delivered by trained folk, usually from third sector organisations. So,
is that going to be a big waiting list for that?
No, that's it's immediate.
Straight away. Because I spoke to some of the when I was launching this podcast, I spoke to 2 or 3 smaller charities that were dealing with, they were almost picking up the slack. Was the quote that somebody gave to me, and one of them said to me, "Please don't put our number on your podcast because we're swamped. We don't have the volunteers, So it was almost as if they were panicking about it.
Okay. Well, I recognise the pressure on some of third sector organisations, but the ones that are delivering the distress brief intervention, it tends to be the bigger ones, I've got to say, that are doing that. So it's SAMH and some of those that tend to be doing that work. But they they offer a callback within 24 hours of referral. And then they deliver the intervention over the next 2 weeks. But it's a short-term intervention that I think is where we think it will evaluate is that it will be helpful in people who have distress and who are really worried about their situation, but probably not a treatment for mental illness as such. That distress level. But just while you're on about other sources of help, because I mentioned when I was doing the media brief last week, I mentioned the Samaritans number, and also breathing space, and Samaritans actually were grateful that we'd mentioned that. So they are very much keen to make sure that their facilities are open and available. And if you really are desperate, and Samaritans offer a tremendous service. So their number is 116 123.
Because I always think I've still got this idea in my head of the Samaritans as being a last resort, as being hanging off a cliff, but it's not, is it? It's about having somebody on the other end of the phone.
Exactly. No, I mean, you pick up the phone to Samaritans, there is someone there who's a trained counsellor, and they'll just talk to you. You don't have to be at the end of the line before you. So and then the other one, of course, is breathing space. So breathing space is part of NHS 24, but they offer that immediate support and counselling as well.
I've got a friend that phoned, this is a couple of years ago, phoned one of the smaller charities, and I think they had a trainee on. I'm not sure what it was, but the girl on the other end of the phone said, "Why don't you just try and forget about it and cheer up?" And do you know what? That actually did cheer them up, because they had an anecdote, they had a story about it. What I'd like to ask about now, Alastair, is do you think that mental health in general and the different aspects of it should be taught in schools to young people?
Yes. Simple answer. But I think I think we need to be careful about how it's taught. One of the pillars of the curriculum for excellence is supposed to be health and well-being, and mental health is absolutely core to that. Mental health is very much a part of it. So I think we should, yes, of course, we should be teaching young people. We should be teaching young people about awareness of mental health. So I talked a wee bit about earlier that everybody has it. It's not something that that just affects some people. Everybody has mental health. Sometimes it's a bit better than others, and in some people it's a bit better than others. It's that bit about just really understanding it, trying to reduce the stigma, so that it's okay to talk about.
So what we could do is like what you're talking about in the GP practices of having a mental health nurse there. We could maybe in the future have a mental health specialist in schools, like the nurse that we used to have coming around.
One of the government initiatives. I mean, I only joined Scottish Government just in the middle of last year, but before that, one of the things that they were already pushing is the mental health counsellors in every school.
Right.
So that's good, and it's good as a response where an issue has been identified. But I think what we're both talking about is the idea that actually you'd want this as core for everybody, and not just if you've got a problem.
Because it just seems to be, to me, it just seems to be in the last 5 to 10 years that people have realised that it's okay to not be okay. You said that in the briefing last week. It's okay to not be okay. And people are now going, well, Janie Godley's talking about it, or, Gail Porter's talking about it. And like I had Darren Connell on last week from Scott Squad, who's got a lot of very young fan base talking about it. So I think the more we open the dialogue, the easier it becomes for everybody. And that's why I started this, because I just wanted, none of us that have been on this have been medical experts or mental health experts, and I put that at the end. Please don't take anything I say seriously in case I've said something dreadful. But that's why I really wanted to get you on, Alastair, because you know what's going on in the future. This has probably been the weirdest, creepiest year I've ever experienced, and that everybody, our generation and younger, have probably experienced. Are you worried about there being, I don't want to use the word tsunami, but that's the way I'm feeling about it, a wave of, even when we get back to normal and we're allowed back out again, there'll have been damage done.
Yes.
What's going to happen?
Okay, so there's been an interesting sort of way of looking at this, which is in the different waves of the pandemic. So we've had a first wave, had a second wave, if you want. I mean, some people I know it was maybe more than two, but this is the second wave. People talk about the third wave as being the health impact of the reduction in health services. So maybe some undiscovered cancers and things. But there's a fourth wave, and the fourth wave is very much the impact that what we've been through over the last year as a population will have on our mental health, or on our collective mental health, and of the health of individuals. So I think we are worried. I'm quite worried that when we reach that great point, there will be a great point hopefully in the next few months, when the number of people in intensive care is way down, that we don't have deaths, that the number of infections is right down. I hope we reach that fairly soon.
Yeah.
But and there'll be a bit of a collective sigh of relief, and that's it. It won't be it for mental health.
No.
Because
and there's no vaccine for mental health.
Yeah, and I mean, we know the rates of distress and trauma amongst health and social care staff are really, really high, and we'll have that to deal with.
There's going to be PTSD, isn't there? There's going to be PTSD.
Yes.
And amongst NHS workers, because they must be. I mean, I think it's only been in the past couple of weeks we've started really seeing on the news what's going on in these wards, because I don't know whether it's now to try and make people take it seriously. But seeing that, how can you deny? There's, the COVID deniers just baffle me. How can you watch that? And how can you stand outside a hospital? So the NHS workers that have been through trauma in a 12-hour shift, leaving a hospital and seeing these protesters, I would go off my head. I would genuinely go. I would lose the plot. I would start a fight with them. I don't know how they're managing the dignity to just walk past them and get on with it.
There's a lot of stamina, and I think the thing is, when you're in the midst of a crisis, sometimes the adrenaline is there and it keeps you going, and you get through and you fight your way through it, but then afterwards, once everything begins to settle down, I think that's when some of the issues will start to really come. The mental health issues will really start to come to the fore.
Yeah.
So we need to be prepared. We're doing a lot to ramp up support for health and social care staff. So and again, it's a range of things. So it goes from websites through psychological support right through to specialist psychiatric support. So there's a whole range of different things that we're doing for health and social care staff.
It's good to know. One of the things that I really liked about the what is it called again?
Clear Your Head.
Clear Your Head. One of the things that I really liked about the Clear Your Head website was it was given practical community solutions, because what I thought was, we're going to have to all keep an eye on each other in our communities, rather than relying on a health service that's maybe getting ready to brace themselves for what's coming. But if we start now kind of keeping an eye on each other and doing the things that are suggested on that website, it will almost be like, my friend Jenny Godley talks about an emotional life jacket. Get your emotional life jacket on and keep your friends and family afloat. If we all do that and we all keep an eye on each other, it's not going to sort things out, but it's going to maybe stop things from getting catastrophic.
Well, it can hopefully help, and the sorts of things that, if I'm trying to help someone with depression, anxiety, then a lot of the things that I would suggest that they do are things that anybody can do, whether you've got depression and anxiety or not. So, you always think of it in terms of the sort of biological side of things. So, yeah, for me, that might mean medication in terms of treatment. But in addition to that, there's the benefit that you get from exercise and diet and things, and looking after those and careful about those. Then there's the psychological, which is how you think. Thinking more positive, being able to identify the things that help you to think well, maybe doing some mindfulness and things like that as well. And then there's the social, and social, it can be about purpose. So about just, what am I here for? Why am I doing what I do today? And it can be about friends, family, maintaining contact, or actually just getting out and doing something. So whether that's arts, crafts, whether it's music, whether it's whatever you're into, it's just doing that purpose and activity. And
because I've worried about the fact that, I mean, because I live alone, and I've been really quite. I've suffered a lot from agoraphobia in the past. Back when I used to be a lot heavier than I am now, and it used to kind of be a problem to leave the house. And then I became a walking addict, and I was out all the time. But in the past few months, I'm finding it. I'm feeling that creeping back, that I'm a little bit concerned about going back out into the world. And I just keep the door shut and stay in here, and it's fine so far. But I'm almost kind of concerned about my own re-entry into the atmosphere, like a spaceman returning. That it's going to be odd.
Well, and like with anything else, it's the approach that you and many people will have to take. I think it's about gradual. So it's about not expecting that one day you're just going to walk out there and everything will be back to normal and everything will be fine. You have to build up to it, and you have to go at your own pace, and you have to do a little bit at a time. But the one thing I always say to folk when having that conversation is that if you wait until you feel ready to get right back out there, that might not happen, but it could take a long time before it happens. You actually have to kind of just be brave and take the first step, but take a little step.
See, the thing is, my pals are on my back at the moment about this because they know me well. And I had a bad lung infection in December and had to go to hospital to get checked out. And it freaked me out so much that I haven't actually been back outside of my door since the 17th of December.
Wow.
I haven't been outside in 2021. And my pals are like, come on, go out for a... And I'm just like, no, the next time I go out is when I get the jag. Well, because I've got the panic now going on.
Yeah, in some ways I don't blame you. And for all that I'm saying that we'll need to build up gradually, it's maybe still a bit early.
Yeah.
And particularly if you've got risk factors and you're worried about, because infection rates we know are still high. So I and certainly in my clinical practice, I would still be saying to folk, yes, we need to do work on building up your confidence and getting you out and helping you to get there, but let's not push it quite yet, because
so as a qualified doctor, you're telling me it's okay to spend 4 days watching Scooby-Doo?
I don't know about that.
Listen,
purposeful activity, Tom.
Purposeful activity is purposeful. Come on. Alastair, thank you so much for joining me today. It's been really informative, and you've answered a lot of questions that I've been wondering about for the past few months. Alastair, thank you so much, and stay safe.
Indeed, you too.
Thanks, buddy.
Okay, bye-bye.
Alastair. Thanks, Alastair. Thank you for taking the time to join me and to tell us the correct answers to things that I've been guessing about the past few weeks. Please do check out that website, Clear Your Mind, that Alastair talked about. It's very accessible, which is what I really think we need. It's clear, it's concise, and if you want to go a bit deeper and get more specialised help, there are links on that website that will help you. So once again, there's the address up there, or up there. Can you see behind me? But thank you again, Dr. Cook, for coming on and taking the time to help us out. And I dropped the posh accent after about 10 seconds. Did you notice? This week, I'd like to thank my sponsors again for being fantastic. RHA Audio, who make these earbuds. Check them out. The link is in the description. And if you need more information, just contact them because their customer service is fantastic. Next week, I'm delighted that my guest is going to be comedian Susie McCabe, who's been a pal of mine for years and years and years. We're going to have a natter, we're going to have a nonsensy laugh and a catch up, and we're also going to talk about what's going on with Susie. So until then, stay safe and keep it heat.